When every minute counts, you need an expert partner by your side to guide you through a cardiac emergency with a simple, step-by-step process. Adaptive instructions and intelligent sensors keep you on track to automatically deliver the right therapy and bridge the gap until care arrives. Act quickly and confidently with Philips AEDs, your partner in the shared mission of helping to save lives. To begin, remove the HeartStart Home from the shipping box. Unzip the red case. An instruction card is included in the case for your reference. Simply pull the red tab to start setup. When instructed, press the orange button.
Self-test. If the orange button is flashing, press it. Verified. Testing.
You'll need to wait about a minute for testing to be complete.
Ready for use.
Once testing is complete, you can remove the setup instructions card from the device. Once you have set up your HeartStart Home, it is ready to be used in an emergency. In case of an emergency, simply open the AED by pulling this lever down. The device will turn on automatically.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Then, just follow the clear and calm voice instructions.
Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
The HeartStart Home walks you through the entire rescue process and lets you do it at your own pace. Once the pads are on the victim, the system itself will analyze the victim's heart rhythm and tell you when to deliver shock, if and only if the victim actually needs it.
Shock not advised. If needed, begin CPR.
And it even guides you through CPR. It's just that easy. Maintaining a Philips on-site AED is easy too. Each system comes with a maintenance sticker to keep track of the two accessories that will eventually need to be replaced: the pads and the battery. On the sticker, write down the install-by date for your spare battery and the expiration date for the pads. When it comes time to replace the battery and pads, all you need to do is pop out the old battery, slip in the new battery, slide this lever to pop out the old pads cartridge, and drop in the new pads cartridge. Each home AED does its own self-testing every day. All you need to do is make sure this green light is blinking. Act quickly and confidently with Philips AEDs, partnering with you in the shared mission of helping to save lives. Innovation and you, Philips.